there were a few interesting and in-depth topics I think really covered this year at ASH. Probably the two most important would be novel treatments in the front line for CML, with immediately following ASH the FDA approval of bosutinib. So we now have 4 drugs approved in the front line for chronic phase CML, which is exciting. It can be confusing, but I think that's our job, is to help navigate. Another important topic that was covered, and I think we're learning more about, would be how to conceptualize treatment-free remission, which is the end of treatment for patients with CML. Also extremely exciting that TKI therapy can put people into a deep remission over time, that in some patients, in the right subset, and that's where the details lie with ASH this year, some more details about who and when. Their treatment can be discontinued safely, and a majority, or nearly half of patients, will not need therapy any longer. There were a few other topics covered as well. In the education session, we saw, I think for the first time, a presentation on cardio-oncology, or cardiology assessment of CML patients, which I believe is an important topic. That CML therapies may have different risks, and with the excellent survival of CML patients, we need to pay attention to that. We saw additional data on the option of treatment-free remission after not first-line but second-line therapy, which I think was important as well, and there have been some recent publications. And something that I'll cover that wasn't at ASH but was at ASH last year, and I think is an important breaking topic, is fourth-generation drugs in CML. The compound ABL001, which shows, I think, great promise by itself in combination, and maybe an answer to the question of, do we have any other agents that are relatively low risk that can salvage patients with either resistance or intolerance, or both, particularly the T315I mutation.